Did you know that nearly 55 million people worldwide are currently living with dementia, and that number is expected to triple by 2050, according to the World Health Organization? It's not just a concern for the elderly. Dementia is slowly becoming one of the greatest health challenges of our time, robbing people of their memories, independence, and ability to connect with the world around them. But here's the truth most people don't realize: the earliest warning signs often appear years before diagnosis, and they're far more subtle than you might expect. You may notice a loved one repeating the same questions, losing interest in activities they once enjoyed, or even struggling with everyday conversations. These aren't just signs of getting older, they could be your first chance to intervene before the condition progresses. In today's video, we'll uncover 10 often overlooked early signs of dementia that could save you or someone you care about years of heartache. Stay with us, because what you learn today could change the future of someone's life. 1. Memory loss involving recent events. Among the earliest and most noticeable signs of dementia is memory loss that specifically involves recent events. While everyone occasionally forgets where they placed their keys or what they came into a room for, dementia-related memory loss is far more disruptive and persistent. It doesn't just happen once in a while, it becomes a pattern that interferes with everyday living. A person may forget conversations they had just hours ago or ask the same question repeatedly without realizing it. They might miss scheduled appointments or important family gatherings, even after being reminded. What makes this particularly concerning is the emotional toll it takes, not only on the individual but also on their loved ones. For example, imagine the heartbreak of a grandmother who no longer remembers the names of her grandchildren, or the confusion and embarrassment of someone who forgets what they were saying in the middle of a sentence. These lapses go far beyond simple forgetfulness. They affect personal relationships, erode confidence, and make daily routines feel uncertain and overwhelming. When memory loss begins to disrupt normal activities, such as managing finances, keeping track of conversations, or following through on plans, it's a strong signal that medical attention is needed. Seeking an early diagnosis is critical. Not only does it open the door to treatment and therapy options that may slow progression, but it also allows individuals and families to make informed decisions about the future. If you notice this type of memory decline in yourself or someone close to you, don't delay. Early intervention can make a meaningful difference in preserving quality of life. 2. Word finding difficulty and language problems. It's normal to occasionally search for the right word or momentarily forget a name. But when these moments begin to happen regularly, and especially when they interfere with daily conversations, they may point to something more serious, such as an early sign of dementia. One of the most common language-related symptoms in early cognitive decline is difficulty retrieving familiar words. This might start subtly. A person calls a fork the eating thing or refers to a watch as the hand clock. Others may pause mid-sentence, searching for a word that's on the tip of their tongue but never quite arrives. Some might even begin avoiding social situations altogether, not out of shyness, but because they're embarrassed by how often they forget words or mislabel objects. These issues go beyond occasional slips of memory. They affect a person's confidence and self-expression. The ability to communicate clearly is fundamental to maintaining relationships, expressing emotions, and navigating daily life. When word-finding problems become frequent or increasingly noticeable to others, it signals that deeper changes may be happening in the brain's language centers. Early detection of these changes is crucial. The sooner this symptom is identified, the sooner action can be taken, whether through cognitive therapy, lifestyle changes, or medical support, to slow progression and preserve quality of life. If someone you know frequently struggles to find the right words, mixes up common terms, or begins withdrawing from conversations, don't dismiss it. These small communication breakdowns might be early whispers of something your brain is trying to tell you. 3. Loss of motivation. Have you noticed someone in your life slowly withdrawing from the things that used to light them up inside? Maybe it's the friend who once loved going on walks but now prefers to stay in bed, or the grandparent who used to spend hours tending the garden, now letting the flowers wither without a second glance. This gradual retreat from passion and pleasure could be more than fatigue or aging. It may be an early sign of dementia. This type of behavioral shift is known as apathy, and it often manifests before more obvious cognitive symptoms appear. It's not just disinterest, it's a deeper, more persistent loss of motivation that isn't easily reversed with encouragement. Someone affected might stop attending social events, abandon cherished hobbies, or refuse to leave the house altogether, even when nothing external seems wrong. What makes apathy especially tricky is how often it's confused with depression. But while depression involves sadness and emotional pain, apathy is marked by emotional flatness, no desire, no drive, and often, no explanation. This change arises from neurological disruptions in areas of the brain that regulate goal setting, emotion, and initiative. If you recognize this pattern in someone you care about, don't brush it off as just a phase. Persistent loss of motivation should prompt a deeper conversation and a professional evaluation. The earlier we understand what's really going on beneath the surface, the sooner we can help preserve that person's independence, dignity, and connection to life. 4. Frequent falls. It might seem innocent, tripping over the edge of a carpet or stumbling slightly on a flat surface. But when these moments start to happen more often, it could be your body sounding a quiet alarm. Frequent falls, especially in older adults, are now being recognized as one of the earliest indicators of cognitive decline, long before more obvious memory problems emerge. Scientific studies, including a 2021 report in Frontiers in Neuroscience, have revealed a compelling link. People who eventually develop Alzheimer's disease often begin experiencing more falls years before their official diagnosis. These falls are not simply the result of aging muscles or poor vision. Instead, they can reflect subtle but critical changes in brain regions responsible for balance, spatial awareness, muscle coordination, and reaction speed. What does this mean in everyday life? A person may begin losing balance when turning too quickly, misjudging steps, or finding themselves unable to react in time to prevent a fall. These seemingly minor slips can lead to major consequences if left unchecked. If you observe someone falling more often than usual, or brushing off these incidents as nothing, it's time to pay closer attention. Frequent falls are not just about clumsiness. They can be early whispers from the brain that something deeper is beginning to change. Seeking medical evaluation early could uncover underlying neurological issues and help prevent further injury or cognitive decline down the road. 5. Getting lost in familiar places. Picture this: you're on your way to the grocery store you've visited every week for years, or heading to a close friend's home where you've spent countless evenings. But suddenly, the route feels unfamiliar. You hesitate at intersections, second-guess turns, or even forget why you're on the road at all. This isn't just a momentary lapse in memory, it's a disorienting experience that can shake a person's confidence and signal something much deeper. Getting lost in familiar places is one of the most troubling early signs of dementia. It's not uncommon for individuals experiencing cognitive decline to suddenly require directions, or reminders to navigate through neighborhoods they've lived in for decades. What was once automatic becomes confusing. The brain's spatial awareness, the internal GPS that helps us map our surroundings, begins to fail. Unlike ordinary forgetfulness, this type of disorientation indicates that the areas of the brain responsible for spatial processing and memory integration are being affected. It's not just about forgetting a turn. It's about losing the mental framework that tells us where we are and how we got there. If you notice this happening, either to yourself or someone you love, it's not something to overlook. Disorientation in familiar settings should be treated as a medical priority. Consult a healthcare provider as soon as possible. Early evaluation can help uncover whether this is part of a more serious cognitive issue, and timely intervention could make all the difference. 6. Difficulty sleeping. Have you ever found yourself, or someone close to you, tossing and turning through the night, waking up repeatedly, or drifting off during the day despite having had a full night in bed? These disturbances aren't just signs of aging or stress. They may be one of the earliest and most overlooked indicators of dementia. Sleep disturbances such as fragmented sleep, frequent nighttime awakenings, or prolonged daytime drowsiness can signal changes in the brain's internal clock and memory centers. In particular, conditions like Lewy body dementia are known to cause vivid dreams, physical movements during sleep, or even talking aloud, symptoms that point to neurological disruption far beyond a restless night. Why is this important? Because sleep is not just a time of rest, it's when the brain clears toxins, consolidates memories, and repairs itself. Without consistent, deep sleep, cognitive functions such as memory, focus, and decision-making can erode faster than we realize. It's a silent acceleration of decline, happening one night at a time. Think about it. How many times have you, or someone in your family, complained about poor sleep lasting for months? When sleep issues persist and begin affecting daytime alertness, it's time to investigate further. These may be the first signs of something more serious than insomnia. Addressing sleep difficulties early is more than a matter of comfort. It's a crucial step in protecting brain health and slowing the progression of cognitive disorders. If these symptoms sound familiar, don't wait. Seek medical evaluation and consider a sleep study. A good night's rest may be one of the strongest defenses we have against dementia. 7. Physical symptoms like stooped posture or slow walking. When we think of dementia, most of us focus on memory loss or confusion. But what if your body was trying to speak to you before your mind did? Subtle physical changes, like a hunched posture, noticeably slower movements, or a shuffling gait, could be early neurological clues that something deeper is affecting brain function. These signs often get brushed off as ordinary aging or orthopedic issues. It's easy to assume that leaning forward when walking or taking smaller, unsteady steps is just due to joint stiffness or weak muscles. However, research has shown that these changes often accompany early-stage dementia and may reflect declining communication between the brain and muscles. A person may begin dragging their feet, have difficulty initiating movement, or appear to be walking on autopilot. This isn't just a mobility issue, it's a sign that the nervous system might be compromised. The same brain regions involved in motor coordination are also responsible for processing thought, memory, and emotional regulation. So, when movement becomes labored or unbalanced, it's a red flag. If these physical symptoms occur alongside memory problems, personality shifts, or confusion, don't ignore them. Consult a healthcare provider to explore whether these changes may be linked to early cognitive decline. Catching the connection between body and brain early can make a significant difference in diagnosis, treatment, and quality of life moving forward. 8. Difficulty with simple tasks. Have you ever watched someone you love suddenly struggle with something they've done for years? Maybe they forget how to cook a favorite dish, leave the stove unattended, or can't remember how to balance a checkbook. These aren't just slip-ups, they could be early warning signs of cognitive decline. Tasks that once came effortlessly, like following a recipe, setting a table, or managing a budget, may now feel confusing or exhausting. The brain begins to lose its ability to organize steps, recall sequences, or even recognize the purpose of basic objects. What used to be second nature becomes a frustrating, often embarrassing challenge. Many times, these changes are dismissed as stress, distraction, or simply getting older. But when these difficulties persist or begin to interfere with daily life, they point to something deeper happening in the brain. Left unrecognized, this cognitive strain can snowball into more severe impairments. The good news? Early identification of these changes allows for timely intervention. With the right support, medical guidance, memory aids, structured routines, many people can maintain their independence and continue living meaningful, safe lives for much longer. Recognizing the shift from occasional forgetfulness to functional difficulty is the first and most important step. 9. Loss of interest in conversations. It often begins quietly. A person who once lit up the room with stories, jokes, and warm conversations suddenly grows distant. They stop asking questions. They nod politely but rarely respond. The room feels quieter, not because the volume dropped, but because their presence has faded into silence. You might chalk it up to aging or a bad mood. Maybe they're just tired today. But over time, this silence deepens. They stop picking up the phone. They decline invitations. They sit in family gatherings, eyes unfocused, drifting somewhere far away even as life unfolds around them. This is not just withdrawal. It's not just personality change. It can be the brain quietly retreating, losing the ability to process conversations, recall words, or follow a simple back and forth. To avoid mistakes or embarrassment, the person chooses silence. But the silence itself becomes a symptom. Recognizing this emotional distancing as a potential early sign of dementia is critical. Conversations are more than social niceties, they're mental workouts that keep the brain engaged. If someone you love begins slipping into these long pauses, don't let it go unspoken. Reach out. Encourage expression. Seek help early. Because behind the silence, something deeper might be calling for attention. 10. Fixed gaze and reduced eye movement. At first glance, it may seem unimportant, a person staring off into space, eyes fixed and unmoving. But behind that blank gaze, something deeper could be unfolding. Emerging research has found that subtle eye changes may serve as an early warning sign of cognitive decline. In fact, a groundbreaking study published in JAMA Ophthalmology suggests that changes in the retina, the light-sensitive tissue at the back of the eye, could predict the onset of Alzheimer's disease up to 17 years before symptoms fully appear. This fixed stare, reduced eye tracking, or trouble focusing may not be a matter of fatigue or distraction. Instead, it may reflect how the brain is beginning to struggle with processing visual information. You might notice someone repeatedly bumping into furniture, having trouble judging distance, or staring for long periods without blinking or responding. These aren't simply quirks. They're quiet signals from a nervous system under strain. While often overlooked, visual behavior is deeply tied to cognitive function. Our eyes do more than see, they move, track, react, and respond. When they stop doing so, it may be time to investigate. If you notice these patterns in someone you care about, especially alongside memory or behavioral changes, don't wait. A thorough medical evaluation could reveal what their eyes are already trying to tell you. While there's no guaranteed way to completely prevent dementia, Experts agree that adopting healthy lifestyle habits can significantly lower your risk. And the good news is, these changes don't have to be complicated or expensive. Start by staying physically active. Just 30 minutes of walking a day can boost blood circulation to the brain and support a resilient nervous system. Following a Mediterranean-style diet, rich in fish, olive oil, leafy greens, and whole grains, is a simple yet powerful way to fuel your brain with essential nutrients. Don't forget to challenge your mind. Engage in puzzles, read thought-provoking books, or learn new skills. Every time you learn something new, you strengthen your brain's neural connections. Social interaction is also a kind of vitamin for your brain. The more you stay connected with others, the more agile your mind becomes. Sleep plays an equally important role. Aim for at least 7 hours of uninterrupted sleep each night so your brain can rest, recharge, and eliminate built-up toxins. In addition, avoid smoking, limit alcohol intake, and manage chronic conditions like high blood pressure or diabetes, all of which are known to accelerate cognitive decline. Don't overlook regular checkups for your vision and hearing, and practice healthy ways to manage stress. When combined, these habits create a strong foundation for long-term brain health. Dementia is not inevitable. You have the power to rewrite your cognitive future, starting today. The signs we've just explored may seem small on their own: a forgotten name, a missed turn, a quiet withdrawal from a conversation. But together, they paint a picture of a brain that may be quietly asking for help. The earlier we listen, the more power we have to act, support, and protect the people we love. Dementia doesn't have to take us by surprise. With knowledge, awareness, and timely care, we can hold on to moments, memories, and meaning far longer than we ever thought possible. If you found this video helpful, please don't keep it to yourself. Share it with someone who needs to see it. Hit the like button, subscribe to our channel, and tap the bell icon so you never miss another insight that could make all the difference. This is incredibly healthy, helping you stay informed, empowered, and connected every step of the way. We'll see you in the next video.